Welcome, everyone. Thanks for joining tonight. We're going to give people just a minute to join, and then we will get started. All right, welcome everyone to our second annual SSCD College Summit. The Society for the Study of Celiac Disease is an organization representing health providers in celiac disease, and there's such an amazing group of individuals who really want to see their patients succeed. And so we are so excited when Dr. Verma had the idea to start this summit last year, and incredibly grateful to Megan Donnelly from Schar for helping us get this summit together and offer a scholarship to students who attend tonight. So welcome everybody. We have an amazing group of speakers tonight. We have Dr. Ritu Verma, who is the president of the Society for the Study of Celiac Disease, as well as the head of the Celiac Disease program at the University of Chicago Celiac Disease Center. We have an amazing group here to help out Dr. Verma tonight. I'm Vanessa Weisbrod. I'm the Chief of Education and Community Engagement for the Celiac Disease Foundation. We have Megan Donnelly, who's a dietitian with Schar, Jonna Goldmore, who is a clinical social worker with Boston Children's Hospital, and we have Andrew Ford, who is a gastroenterologist with Metro Health. And perhaps the most important person we have here tonight is Emma Kausen, who is a recent college graduate living with celiac disease, who is going to help us navigate through some tricky situations later on tonight. We also have the amazing Marcia Gales from the Celiac Disease Foundation, who will be helping out as well tonight. So welcome everyone, and thank you so much for being here tonight. Tonight, we're going to go through a bunch of different things. We're going to talk about ways to get support with being in college, handling tricky situations, how Schar can help you with food service providers, and then some closing remarks at the end, including how to apply for the scholarship tomorrow. So we wanted to start out by just learning a little bit more about who all of you are. You'll see that if you open the chat, you're able to send messages just to us panelists, not to each other. But so we really just want to hear a little bit from you and learn who you are. So first of all, can everyone tell us what part of the country you are from and whether or not you know where you're going to be attending college? So go ahead and start putting some of those answers into the chat. And Megan, if you could take a look for me, I can't see them with my screen shared.
Yep, so we have Boston, Missouri, Connecticut, but from Virginia, we've got Georgia, Massachusetts, Chicago, Iowa, lots of Boston people, that's great. Eastern Montana, that's fun. Indiana, people who are going, to school in a very different location than where they're from, like Florida and Arizona and Washington State, Colorado, Ohio, Chicago.
So big group, lots of people all over the place.
All over, yeah.
All right. At what age were you diagnosed with celiac disease?
Oh gosh, another big range. We've got kids as young
There's
as
4 from 16, 17, 1.
Yep. I'm seeing age 12, 17, very young, 3, 4, and 5, 11. Yeah, kind of, again, running a big range.
Emma, how old were you when you were diagnosed?
I was diagnosed when I was 16, so just a few years before I went to college.
I was diagnosed when I was 21, just before my senior year of college. It's actually my 20th anniversary of getting diagnosed. And Andrew, how about you?
21 as well.
Oh, so you know.
Yep.
Have you thought about how to eat gluten-free in college, or have you been in touch with your college already about eating gluten-free there?
Seeing all yeses so far, so that's great. In the process, yes, researching, seems like people are trying. Hopefully we can help you. There's some people who are saying that they're looking into it, trying to find resources.
Great. Well, you've come to the right place. And finally, before we go into our presentations, do you know how to get in touch with your doctor on your own? And we don't count asking mom to make the call for you.
Mixed answers here. Some yes and some no. People are saying my chart, that counts, so that's a yes. Yes-ish. I see some of that, yeah.
Awesome. All right, well, we're going to have a really great night tonight, and we're going to start out with Dr. Ford's celiac story. So take it away, Dr. Ford.
Thank you. So yeah, we had a little sneak peek there. So my name's Dr. Andrew Ford. I am a gastroenterology fellow at Metro Health in Cleveland, Ohio. And I have celiac disease, and celiac is really what got me into medicine in the first place. So I'm hoping to share that passion with you guys, and also, more importantly, as somebody who got diagnosed in college, I really want to make sure that you guys feel a little more comfortable going into college with this disease, because it can be intimidating, but I mean, it sounds like you guys have a good handle on it, but the more comfortable you can be, the better time you'll have in college. So as I said, I was diagnosed at 21 in 2011 while in college. And this story, I still laugh about it to this day, because I'd gotten tested just out of the, because my father actually was diagnosed in 2011 as well. And I was just getting the routine family testing. And I was at a pizza party when I got the My Chart notification that some test results were ready. And what do you know, it came back positive, and the workup was continued, and I do indeed have it. So that was my last gluten there at that pizza party. But it's been a journey, and I'll tell you, you guys are in a better spot going into college knowing about it. And I'll tell you, the innovations in the gluten-free space that have happened over the last decade, it's just remarkable, the amount of food and the amount of options we have in the gluten-free space. So you guys are in really good hands, and I hope you guys can feel empowered about this. So just a little bit more about me. Because I'm a gastroenterology fellow, my specific research interest is celiac disease. So if you guys are thinking medicine, thinking that you want to get involved in this, I'm happy to make connections afterwards. But otherwise, outside of medicine and outside of all this, well, I guess it's not outside of the celiac disease realm, my hobby is cooking. And that was actually something that came on as a result of getting diagnosed with celiac disease. So as I said, my goal today is to kind of kick things off and really prime you to see that you're in a great spot going into college. The disease is by no means limiting for you. And I hope I can just make you feel a little more comfortable in that. Next slide. And so I just want to pull the chat real quick. So what's one question you guys have about going into college with celiac disease? I'm going to try to customize this to what you guys want to know. I'll give a few seconds here to see what comes up in the chat.
Andrew, we have one in the Q&A actually. Is there an easier way to get food while in college that is gluten-free?
Sorry, can you say that again?
The question is there an easier way to get food while in college that is gluten-free? We have another one that says, what is your advice if college isn't handling protocols? And then we do have a few coming in the chat. So they're just in two places.
Okay, great. Thank you for, that's where the Q&A is. Still getting the hang of the Zoom stuff. So as far as the easiest way to get gluten-free things, it's really going to be college dependent. I wish I could say that there was a one size fits all approach, but it's always going to start at the Office of Disabilities. When I was in college and I got diagnosed, that was where I made my connections to figure out which dining halls had the gluten-free accommodations. What exactly did I need to ask for in terms of accommodations? They were very helpful. So the Office of Disability Services is going to be vital in helping you navigate that. And then as far as other ways to easily do it, the best thing you can do for yourself, if you know we're going to go to college, spend some time in the college town before you get started. So I didn't have that opportunity, but like going back, if I had gone in knowing I had celiac disease, I would have wanted to scout out what restaurants are gluten-free, and more importantly, which ones actually do abide by the protocols. So definitely getting a sense of where those restaurants are, which dining halls have the gluten-free accommodations. Things that you can get your hands on now will be immensely helpful once you go there next semester. And then I think there's a question about what can you do if the schools aren't abiding by the protocols. So I assume that's in part asking about like what if the dining halls aren't abiding by protocol, which is a great question. And I mean, quite simply, again, it goes back to the Office of Disability Services. They know that this is something that needs to be taken seriously. So it's extremely important to let them know that, oh, this dining hall that you were told would abide by gluten-free standards is not doing so, whether it's by cross-contamination or otherwise. And they will be your advocates in finding an option for yourself. Let's see, what are the other, lots of questions now. Shout out to spaghetti being the favorite. Yeah, spaghetti is a great pasta. How can I help my school bring awareness to dining halls? That's a great question. And sometimes it's as simple as finding the other people who have that have celiac disease on your campus. When I was diagnosed like right as attention was being brought to celiac disease, and one of the most important things that I was able to do when I got diagnosed was find other people who have it. And we actually went to the Office of Disabilities and said, hey, there's only one dining hall right now that has this option, and it's on the opposite side of campus. What can we do to facilitate some change here? And just by some polite lobbying, we were able to get much more robust options in the central dining hall, which was extremely helpful. So it can be as simple as finding the people who you share this with. And in turn, you might make some good friends that way. That I still stay in touch with my friends to this day with it. Oh, I love this question. How badly is social life affected by celiac disease? It's not. Well, actually, I should dial that back. You will have to make adjustments, and there will be compromises. There's no doubt about that. As I'm sure you all know, you can't drink beer, for instance, and beer happens to be a very popular drink. Of course, assuming once you are 21, there are other options, hard cider, numerous options that don't have gluten in them. And at the end of the day, you can also just grab a water, like they have those canned waters that you can grab to kind of blend in. So, I mean, it's very much a matter of compromise, but it's not going to be to the point where it affects your social life negatively. Let's see. And is making your own food a good option? As I said, I got into cooking when I got diagnosed with celiac disease because yes, it's you are the quality control in that case. One of the challenges can be when you have a shared living space. So if you're in like a shared kitchen area, just make sure that you have your own utensils, your own pots, pans, things like that. And just make sure that anybody in the area is aware, like your roommates or dorm mates, just make sure that they're aware of the need to not mix things together, because it can be very easy to do that in shared space. And yeah, that way you're not relying on other people, and actually it ends up being cheaper when you cook your own stuff, to be quite honest. So it's a nice little added bonus there. Open the Q&A, see if I'm missing anything. How can I cook gluten-free in a dorm setting? So somewhat similarly to what we were just talking about, it really depends on your dorm setup. So, I mean, my first couple of years, there was a kitchen that was shared with the dorm. So I just had my own pots, pans, utensils, gotta kept those in the room, clean them separately, and then just wiped down as best I could everything. And then when I got to junior year, that was when we were in those in the suites that had like a kitchen in them. So I just had to make sure my roommates were aware of it, and they were very cool with it. And actually, that kind of segues into another question: how hard is it to find roommates and understand? It can be challenging at first, especially if you don't know anybody there. But people want to make friends when they get to college. They want to so they tend to be accommodating. As long as you're clear and communicating with them, it won't be too difficult. Just maybe a little bit at first. Let's see. I'll answer a couple more here, and then I'll just get to some final points here so we can get things rolling. What college did I attend? I attended Miami University, and I always say the cold one, so Miami University in Ohio. And then my favorite food is steak. I love that. Did you ever accidentally consume gluten at the dining hall? Was there ever cross contact? Unfortunately, again, this is about a decade ago, but yeah, I did get cross contamination. It always kind of came up for me as the dermatitis, and it was always just a matter of like kind of going back, looking at, was it something that maybe the ingredients just by nature could be cross contaminated? Like sometimes you get that with oats that aren't gluten free. Yeah, it can happen that you get cross contamination in these in the cafeterias, but again, just like not only being in touch with the disabilities offices, but also getting to know the people in those dining halls can be really helpful. And actually, they're very like, I mean, the chefs and the folks that work in the cafeteria in my college, they're sweethearts. So they're more than happy to help you out navigating this. And then this is the last one I'll get to, and then I'll try to go over the other points I've got for you. What is the best way to communicate with your new friends / roommates about celiac disease? That's a great question. Obviously, you don't want to just like shake hands and be like, "Oh, hi, I have celiac disease." But make sure to introduce it early in the conversations. You are not your disease, but it is an important part of navigating the college process, and you want to do it in a way that's healthy for you and safe for you. What I would say is advocate for yourself, politely but firmly, and just more importantly, they'll probably want to know, what does that mean for them? So like if you're in one of those suites that has a kitchen in it, just ask politely, hey, can you just make sure not to use my Tupperware, not to use my utensils? It's not that I don't like you, it's just want to avoid cross-contamination. Anybody who has a basic understanding of allergies, even though celiac disease isn't an allergy, if you just explain it as an allergy, I find people understand it much better. So then we'll go on to the next slide just to see if I can clean up on some other points. At the end of the day, as I was just getting at there, communication is key for all this. So communicate with your Office of Disability Services, communicate with the dining halls, communicate with your roommates. Just be clear about what you need and don't settle for less. You deserve to go to college comfortably, and you deserve to not have this limit you. So when you sit down to think about the accommodations that you want for yourself, don't hold back. Of course, you always have to do things within reason, but you can ask for them to make sure that there's a dining hall that can accommodate you without cross contamination. That's completely fair. And the other thing is, I think I got to this earlier, but just if you know where you're going, spend a little bit of time before the semester starts to get to know the college town, know where the grocery stores are, like which ones carry the gluten-free things. My favorite grocery stores, Trader Joe's, Aldi, those ones were always like easy to fall back on for the gluten-free options. I'm not sponsored by any of them, but I can vouch for them having good options. But yeah, just getting a lay of the land that much quicker is just one less thing you have to worry about once the semester starts up. But with that, that's all I've got for you guys. I want to say thank you for coming here tonight. thank you, Schar, for sponsoring this. I really wish when I was diagnosed there was something this awesome. This is really great for you guys. And if you're curious about what celiac disease research looks like, or what getting into medicine to pursue a career in celiac looks like, don't hesitate to email me, dm40@gmail.com. I'd be happy to make connections. And again, thank you guys for your time.
Thank you so much, Dr. Ford. Now I'll ask Dr. Verma to come on the screen and take it away.
Okay, thank you, Vanessa. Thank you, Andrew. This was fantastic. So, you know, when you get diagnosed while you're in college, it's a different story. But let's say you've been diagnosed prior to college. What do we have to do? So next slide, please. I've always said, and I'll say it again, do not pick your college just based on the fact that they have gluten-free food and that you have celiac disease and you only need to go to that college. There was a question in the chat about being in a dorm that is only for people with celiac disease. I would say the answer is no. Don't cut short on your experience in college, and don't just hang out with people who have celiac disease itself. You're a person and you're not a disease. So I would say don't do that. We'll have people who can help you with that in the next slide, please. So, you know, we talk about college. Your parents have been preparing for a lifetime. From the moment you were born, they were preparing, going to college. And now it's your turn as the students to not just think, I'm just going to go to college. You've got to prepare yourself. And the next slide. So what does preparation mean? It's so important that you think about this as a chronic disease. It's something that you have to deal with for the rest of your life. So you want to know how to prepare yourself as you're going to college. So very important that you set up an appointment with your clinical team. And every institution, it's a different group of clinical teams. So some places will have a physician, a dietitian, a psychologist, a social worker. Some teams will be only the physician, some will be physician, dietitian, and so on. So whichever is your clinical team, make sure you set up an appointment with your team, not on your regular appointment where you are checking labs and you're doing this, that, and the other. This is a college appointment that you make. So you have the devoted time. It's that half an hour, 45 minutes, an hour that your physician and your team will spend with you to discuss about college and how do you prepare yourself and be the best that you can and feel comfortable when you get to college. You can decide whether you do that with your parents or without your parents. I think sometimes it's a good idea to have your parents, and I'm not just saying because I'm a parent of 2 children with celiac disease, but sometimes your parents can be your eyes and ears. If this is the first time you're having an appointment just with your physician, it can get a little overwhelming. So you can decide. You could do half the visit alone with your clinical team and the other half with the parents there, so that you're sort of transitioning away from that place where only your parents are doing a lot of the conversations. And before you set up for that appointment, the night before, the week before, sit down with your parents and come up with some questions. Then you will really get the most out of that appointment. So think about life, think about what you need to do, discuss with your parents, your siblings, and prepare a list. And the next slide, please. So some of the topics that you can think about is maybe you were diagnosed so long ago that it's become a way of life. So maybe now I want to learn what is celiac disease, and you can come up and ask your provider to give me a little refresher about the disease and talk about if you have any symptoms when you get exposed, what should you do? Because again, this is life. As I tell my patients, it's life. We live in a world, there's a lot of gluten around us, so we are going to get cross-contaminated at some point or other. Don't be afraid, learn from that situation. But what do I do if I get symptoms? Ask your providers. You talk about how your diagnosis was made, get to know your disease, get to know it totally. And then comes the more nitty-gritty kind of things. How do I get my medical records? Might seem very simple, but sometimes you've got to sign some papers. Sometimes you have to do some of those things. So ask those questions while you're in the office. And then you want to think about it, that do I continue with the same team, or am I going to have another team when I go to college? Am I going to be far away from college? Do I want to go away from pediatrics to an adult gastroenterologist, and so on? So those are questions you think about. And then how do I get the 2 teams to work together? This is a question for the team that's taking care of you now. And always don't forget your parents. They've been with you for all these years. They've managed what you have. They've taught you what they have. They've provided for you. So try and keep them involved. They don't have to be in every appointment with you. You are the one who should take charge, but try and keep them involved as well. And then big questions come on with insurances and so on. So these are just guides of what questions you can bring up when you're coming for this visit with your providers. Next slide, please. And of course, that last comment, I just don't want to grow up. Well, you have no choice. You're grown up now, so we move on. So what do you want to do as you're thinking? You have now made that appointment, you've met with your team, you kind of know what you need to do, but then you have to have follow-up. And so at some point you have to have follow-up. So remember, your parents knew this, now you have to take charge. It takes a little time to schedule appointments. So always think about, I'm going to be home. If you're staying with the same team, I'm going to be home in May. Let me make an appointment with my team in May. So plan ahead. And a lot of things in life, plan ahead, make those appointments, get the communication going. You should have learned by now from your team, how do I get in touch with you? If I'm in college and I have a symptom, so you get to know all about the portals, make sure the portal is active, just send a test message. You can just send a test message to your provider team and say, I'm in college, hello, just saying hi and testing. So then you know that when you really need that mode of communication, you will be able to jump in and send a message to your team. If you are going to see someone else near your college, again, keep in mind, appointments are hard to make. So start making appointments 6 months ahead of time so that you can have a gastroenterologist close to school, transfer your records. Always remember those things. If you ask for things at last minute, often offices cannot help you. So plan ahead, involve your parents with that. Next slide, please. So when you get into college, you've already done the disabilities and all, and you'll hear a lot more about that later on. But when you're at the University Health Center or when you're doing your college tours or anything, find out what is available on campus, in the health center. Make an appointment with the nurse in the health center and ask him or her, what do you do here? Do you do blood work here or not? Because your doctor is going to ask for follow-up blood work. You don't want to try and figure out, oh, where's the LabCorp, where's the Quest? So find out from the nurse, do you do labs right here or not? Where do I have to go if I need blood work? And then just know mentally where the lab is in terms of your campus. Find out on campus, do they have any ability to give IV fluids or things like that? What all can they do if you have a reaction? Much important to know before the reaction happens in terms of where you have to go. Where's the local emergency room, or where's the urgent care? Hopefully you never need it, but it's always good to know where it is. You want to find out if there are pharmacies close by. You might be on thyroid medications, you might be on other medications. Where's the pharmacy? Does the pharmacy do drop-offs, or do you have to go there to pick up the medications? There are many pharmacies that will actually mail stuff to you and drop it off. Where do they drop it off? Do they drop at your dorm? Do they drop at the at the University Health Center? So figure all those things out as you're planning those things. So find out, sit down, take time with the nurse, what can be done. Dr. Ford talked about the grocery stores. Just like the pharmacy, you also want to find out which is the grocery store. Is there a bus that goes from your campus to the grocery store to pick up groceries? Is there a bus that you can take, or transportation that you can take from your campus to the pharmacy? All of those things that were so simple when you were at home, think about the campus as your home, and where all do you need to know? Get to know all these things, be prepared, and you may never need it again. So ask all those questions, be prepared, and now I'm going to hand it over to Vanessa.
Thanks, Ritu. That was awesome as always. So we're going to talk now about getting the right support and getting to your accommodations in the college setting. So, there are lots of challenges that come with transitioning to college that are beyond celiac disease. Many of you will be living away from home for the first time. You might be living in a shared space for the first time. Classes in college are a lot harder and a lot more intense than they were in high school. You're all of a sudden balancing academics, social, and extracurriculars on your own without mom necessarily keeping that calendar on the refrigerator for you. You're making a big step in choosing a major and looking towards a career path, and you're probably starting to balance your finances. And none of this has to do with celiac disease. This is all just normal life. So how do we make sure that your celiac disease doesn't impact any of those things that are just total normal parts of life? So we like to think about self-advocacy and using these advocacy skills to help us get accommodations under existing laws. So there are laws that protect people with celiac disease. The first one is the Americans with Disabilities Act, and celiac disease qualifies for protection under this law because celiac disease impacts major life activities. Then there's this law, it's called Section 504 of the Rehabilitation Act, and it means that schools that receive public funding, and every college and university in the United States does because they accept student loans. And so even if it's a private university, there are elements of public funding that are a part of it. And so because of this, they must accommodate celiac disease and all of the needs that come with it. Chronic illness, it's defined as 12 months or more of major life activity. Celiac disease is forever. If there is, you're never going to outgrow celiac disease. It impacts our ability to eat. It impacts our ability to digest food, our immune function. And so for all of those reasons, it qualifies for protection under these laws. It's really important that you have an advisor that is looped into all of these things and that is a part of the discussions with the disability services so that they know and are able to help you with making sure that you're being accommodated appropriately. You want to make sure that your professors know and understand what accommodations you have. There might be a time when you were exposed to gluten and you're not feeling well and need to miss a class. And so we want to make sure that they're all looped into it. And perhaps the most important piece in college is your communication with food services. The Office of Disability Services should really play a key role in making sure that you're connected to the right people and that you're getting what you need. And then if there are problems along the way, can help you navigate those problems with food services. So what are some reasonable accommodations that we expect to see in the college setting? There's a lot of text on this screen, and I'm going to talk through a lot of it. But really, the accommodations are going to vary by student as well as the school that you're at, because every school operates a little bit differently. We know there are some schools that have a dedicated gluten-free dining hall, or there are dedicated gluten-free stations. We know there are other schools where there's only one dining hall on the entire campus and things are done a little bit differently. So even though there's a list up here, remember that these are all very individual and will change based upon your individual school. So things that we like to see, though, is that there's a staff member that is assigned to help you when you get to school with finding gluten-free options on campus. There should be a dietitian or a food services manager that is knowledgeable about gluten-free food options to help you find what is safe for you to eat. We want to make sure that the school is providing gluten-free food to you that is prepared free of cross-contact, that meets the same nutritional standards as food served to other students. When I was diagnosed with celiac, I was a senior in college and I was 21. And this, as I said, was 20 years ago. And at the time when I went to meet with the dietitian in my dining hall, the only things that they could guarantee were gluten-free were white rice, coffee, and whole fruit. So for the first week, I ate white rice and apples, which we can all agree is not a way in which we should all be functioning nutritionally. And it was missing a whole lot of those important food groups that I should have been getting at every meal. 20 years ago, celiac disease was not regularly seen as a disability, and there weren't the same protections that are available today. Today, when you're meeting with the Office of Disability Services, it is clear that you should be having access to food that is a complete meal. You should have access to proteins and carbohydrates and fruits and vegetables and the same nutritional standards of food that's offered to other students. Depending on how your university works, it may be reasonable to ask that you can pre-order gluten-free meals. Some schools will have students come in for the whole week and order what they want for that week so that it's ready when they come to get it. Other schools, you don't need to do that. It just really depends on how your food services work. We would ask that schools label foods so that it's easy to identify gluten and other common allergens. Typically, you're not going to see just a gluten-free label. You're going to see labels that have dairy on them, nuts on them, and many food groups. We would hope that your food services would have standard practices to prepare gluten-free food that is made free of cross-contact. There should be regular training across food services on gluten-free food preparation as well as food allergy preparation in general. If they are offering foods that are packaged and you have to heat in a microwave, we would want them to have a space that's dedicated for storage of those items so that they're easy to get to and also not contaminated in any way. We would want them to use vendors that accept your meal cards for gluten-free foods. Sometimes schools have cards that, that the students use to pay for various things across campus, and we want to make sure that there are options at those places. If for some reason gluten-free food isn't available in your dining hall, we would absolutely ask that you have access to a housing option that has a fully equipped kitchen. This doesn't happen often, but I've been involved in a number of situations with patient families where this was the best option for the student. And so it is something that, you know, picking the school that is best for you academically and socially may not have the perfect gluten-free accommodations in the dining hall. And so then it is very reasonable to think about asking for housing where you can make your own food. We, in almost every situation in the letters we write, would ask for a refrigerator and a microwave in the dorm room that is for use only by you. We know that students with celiac disease will keep more items in their dorm room. They'll want to store things that can be easily microwaved. And we also know that in dorm rooms, things get really dirty in those very tiny refrigerators and microwave. And so it is absolutely reasonable to ask to have your own mini fridge and microwave. We will always ask for unrestricted access to the bathroom. Gluten exposures happen, and you should be able to use the bathroom when you need to. And finally, but perhaps the most important, is that you as the student and the person with celiac disease need to be the one involved in these accommodation conversations. Oftentimes we have very, very well-intentioned parents who think they should be the ones setting up the plan. But when it comes down to it, the student, you guys, are the ones who are living every day on these college campuses. And it is so important for you to be at the table having these conversations with the food service managers and the Office of Disability Services so that you really understand what you have access to and how you're going to get it every day. So how do we get to these accommodations? So step one is to get your diagnosis letter from your physician. So everyone should start working on this right now if you don't already have it in hand. Most often, your university's Office of Disability Services is going to want a letter that was dated within the past year. So if you are a senior in college or you're in college right now, you're going to want to start asking for that letter now. You're going to send that letter to the Office of Disability Services. So if you're a senior in high school now, you're going to send this as soon as you have decided where you're going to go so that you can start having those conversations. When you go for admitted students weekends, it's a great idea to start talking with them, even though they probably won't sit down with you to have your formal accommodation meeting until once you've signed the contracts and made that first payment. It doesn't hurt to start learning about what the process is when you go to those admitted students weekend. As Dr. Verma mentioned, when you meet with the Office of Disability Services, come prepared with a list of questions and a list of accommodations that you think you would need. It's also really helpful before that meeting to ask them to connect you with another student with celiac disease so you can talk to them about, you know, what their experience has been like. You might also ask your doctor if they have any patients who have gone to that particular university that they could connect you with. There are also lots of online groups where people are constantly having conversations, and it's a great way to connect with people to find others who may be in the same location as you. So once you've met with the Office of Disability Services, a plan will get written and it will detail all of the accommodations that you are going to have. Do not be afraid to advocate for yourself. If something is missing, don't be shy. Make sure you ask about it, because if you don't, you probably aren't going to have access to it during your time at school. So it's really important to not be afraid to stick up for yourself and ask those important questions. Once the accommodation plan is written, it goes into practice, and hopefully it will all go well. If for any reason it doesn't go well, you can request a meeting at any time with the Office of Disability Services, and they can help facilitate getting things put into the right place. Dr. Verma and I have been involved in probably hundreds of meetings with college campuses over the last decade in helping students. And please also do not be afraid to reach out to your physician to ask for help. help, to ask the University Health Services for support. Celiac disease is a lifelong health condition, and we have to make sure that your condition is treated, and that's through the food. And so if you're having problems, do request that meeting and work towards getting help. And please don't ever be afraid to reach out to your physician, to your dietitian for support. They really do want to make sure that you're successful. If things are going well on the other side of things, at a minimum, you do need to meet at least once annually to review the plan and update it. So make sure that you are doing that so there is no disruption in the accommodations. So what are some questions that you should be asking when you visit your dining hall, if you're visiting campuses, or if you're already in school, what should you be asking now? We should be thinking about how are they taking precautions to make sure that the gluten-free food is prepared safely? Do any of the dining halls have a dedicated gluten-free section? Are there other kids eating gluten-free on campus? How do you get information about the ingredients? Is there a section in the kitchen that's dedicated for gluten-free food prep? Are there symbols that indicate that dishes are gluten-free or can be made gluten-free? This is probably one of the most frustrating things, that there's not a global gluten-free symbol, and different food service venues, cafeterias, coffee shops, they all use different symbols. Sometimes it's a cross-grain symbol, sometimes it's a GF, sometimes it's some made-up symbol. And so it's really important that you're aware of what that symbol is and how it's used. Does it mean it's gluten-free, or does it mean that the dish contains gluten? So just make sure you're really clear on what those symbols are indicating. How do you order food? Make sure you know what that system is and how you indicate a special dietary need within it. Are there grab and go options on campus? Does your meal plan allow you to access food outside of the dining hall? Like, are there coffee shops, or are there snack venues on your campus that you can use it for? And most importantly, probably, is your staff trained to prevent cross contact? And are they knowledgeable about ingredient labeling? Almost every staff should receive this training. There are laws requiring how food service organizations train their staff, but it is important to just make sure that they are trained on gluten-free products and they know how to prevent cross contact. So let's talk a little bit about roommates. So roommates are a big deal when you're in college. And it's so important to have open communication with them. Everything is affected by your roommate: your studying, your sleeping, cleaning, and your social habits. And as Dr. Verma mentioned, your roommate doesn't have to eat gluten-free. I actually have never lived with somebody that has celiac disease until I had a child, and he has celiac disease. But none of my roommates through my last year of college or in the years after ever had celiac disease or had to eat gluten-free. And, we had conversations about it, and we made it work in a way that I was always kept safe. And so, I would encourage you to approach these conversations openly and with kindness. Assume that your roommate wants you to be safe and healthy, and work with them to come up with a plan so that you can both be happy together. In the dorm room, as I mentioned before, it is acceptable to ask for your own mini fridge and microwave, as well as if you're in a shared cooking space, to have your own cooking equipment and storage area. There are lots of really busy schedules when you get to college. I remember just constantly being on the go. So it's really important to think about how you're going to eat on the go. Be prepared. Always have snacks in your backpack. Know what the locations are. Jamba Juice is always a favorite quick place of mine to grab a snack. For social events, always be planning ahead. You never know if there's going to be gluten-free options, so either eat something before, bring your own to share, or just really think about how you're going to eat in these situations. Of course, eating at restaurants and getting takeout, the same considerations apply as before you went to college. Now you probably just don't have your parents along with you. So, think about planning ahead, looking at menus, calling ahead so that you know what you can eat safely, and letting them know that you will be needing a gluten-free meal. So these are some ideas from Jacqueline Quinlan at Boston Children's Hospital. This is one of my favorite slides that I have seen on this. So these are some quick snack ideas to keep in your dorm room. Things like hummus and rice cakes, yogurt, dried fruits and nuts, peanut butter or other nut butters, granola bars, string cheese, roasted chickpeas, popcorn, chips, and little packs of guacamole and salsa. These are all really simple things to keep in your dorm room that make for a great quick snack. Also, real food. So, of course, there are going to be very, very busy days where you just want to eat quickly in your dorm room. These are some of my favorite things to prepare out of the freezer or the cabinets. There's now gluten-free Kraft mac and cheese in individual cups. You can buy them in a 4-pack. Again, we don't endorse any of these things. These are just personal preferences on things that are really easy to make. Just add water, pop it in the microwave. There are great individual sized frozen pizzas, oatmeal cups for breakfast, baked potatoes that you can make in the microwave, Mexican casserole bowls, muffins in a mug that are super easy to just pop in the microwave. And these are my new favorite thing. We found these at Wegmans. They're veggie pasta. They come in penne with cheddar, penne and olive oil, and spaghetti style with marinara. They're actually made out of lentils and zucchini, and they are fantastic. They cook in the microwave in 3.5 minutes, and it's a complete meal. So lots of simple options that you can make right from your dorm room. So now I'm going to ask Emma to join me on the screen, and Andrew as well, and any of the other panelists are welcome to join in. So we're going to talk about some tricky situations that come up in the college setting. And these are real life examples from students that Ritu and I have worked with over the years. And so I'm going to share what the story is and then ask Emma and Andrew to shed some light on how they might handle these situations. So meet Jesse. His college dining hall has limited gluten-free options. He's a freshman at a small private university. He had a 504 plan when he came from his public high school. During orientation, he was told that there were plenty of gluten-free options in the dining halls and just to ask when he arrived for his meals. He's been on campus for a month now, and his only options are a salad bar, though the way it's set up, he feels that there is a big risk of cross-contact with the way the croutons and the wontons and the pasta are in the same area as the produce. There's white rice at the International Food Station, and they do have gluten-free soy sauce. He can get a hamburger, a hot dog, or grilled chicken with no bun, and gluten-free granola bars at the coffee shop. What do you think, guys? Is this reasonable, or how would you handle the fact that he thinks he has really limited options?
Yeah, I would definitely reach out to the dining hall staff and see what else they could potentially do for him. What I did when I was in college, since I had a somewhat similar situation, having gluten-free options but very limited, is I would pre-order my meals for the week, which is something that Vanessa mentioned earlier. And I was also in contact with my school's dietitian, and I would get the menu for that week in advance with all of the food items and ingredients that would be offered in the dining hall for that week. And I would pick what I wanted, and I would tell them when I would be there to come get it. And that worked really well for me and helped me not get sick anymore. And you can even, I'd say a good place to start is even just requesting to get salad bar items from the kitchen in the back instead of from the salad bar that everyone else touches. That's typically very easy for the dining services to do for you, and a really great place to start if you're looking to get in contact with dining staff.
Yeah, I think in this situation, this is also one where you might want to look at exercising the option of being able to find like a dorm that has like its own built-in kitchen. I mean, I know those are few and far between, but if Jesse is somebody who feels confident cooking, that's a way to kind of take the middleman out of the equation. And I mean, I ended up in a somewhat similar situation, and that's why I ended up in a dorm that had like one of those kitchen suites. Was because it was much easier for me to do that. And I felt much better once I started cooking for myself.
Great, thank you. All right, so let's go to the next case. So meet Maya. Maya's roommates are extremely messy. She is a junior at a medium-sized university in Chicago and was diagnosed with celiac disease by a local physician 1 year ago. She lives in a dorm room with 3 roommates. The room has a full kitchen, and Maya can use her meal plan points to purchase groceries at the campus supermarket. She purchases naturally gluten-free products and specialty items like gluten-free pasta, bread, and pizza crust. But like I said, her roommates are extremely messy, especially in the kitchen, and are terrible at washing dishes and pots and pans. There are gluten crumbs and residue everywhere, and often her roommates are also eating her gluten-free food because they have not gone to the store. What would you guys do?
So for me, I would really try to emphasize with the roommates that you need to keep a strict area in your kitchen that is just for you and no one is allowed to touch anything in that area. This, and like Vanessa mentioned earlier, the school could potentially arrange for additional appliances to be available in that kitchen, like a mini fridge or a microwave that is just for you. Um, if your roommates don't comply, I would say you can get in touch with the housing office or even the disability office, get them involved. They can arrange for a housing change if that's absolutely necessary, either on or off campus. Also, of course, having access to a kitchen. But also back to the topic of roommates, my roommates that I had in college, they were not gluten-free. This is not meant to scare anyone in any way. You can absolutely live with other people who do not have celiac disease. Um, I just made sure that I communicated openly about my needs and that my roommates had like an understanding of all of that. And if you are really nervous or worried about finding a roommate who will understand celiac disease, definitely do not limit yourself to just living with another celiac, but something you could consider is maybe someone who has another allergy or an intolerance. They understand that space a little bit more than maybe someone who doesn't. And you don't necessarily have to live with someone with celiac disease, but that's a great option to look for roommates who do have that understanding. I know my college roommate, she had a shellfish allergy, so she immediately understood.
How about if you don't make it that it's celiac disease? How about just sitting down and having a talk about how one should be living in sharing space, right? So that it doesn't only become about celiac disease, but it becomes about living in shared spaces, um, and take the celiac out of there. How about that? Dr. Ford, what would you do?
I mean, I agree with that approach because that takes the focus away from the person with celiac and puts it on the fact that these roommates are living in a less than ideal conditions. No, I love that approach, and um, kind of what you were saying too, Emma. Starting just with a conversation with the roommates. I don't think it necessarily needs to go to the housing office right off the bat. Generally, that's kind of the nuclear option. And you certainly can go there if the roommates end up being unreasonable about it. But 9 times out of 10, people are willing to accommodate, and oftentimes everybody's adjusting in college. So it's just maybe people aren't thinking about what they should be doing. You would hope that they would think about these things and staying clean, but sometimes people just need a gentle reminder.
Absolutely. All right, so meet Liliana. She keeps getting sick. She was diagnosed with celiac disease when she was 5 years old, and she's been on a gluten-free diet for 14 years. She chose her small school in New York because they offered many gluten-free food choices. She's now a freshman and has been on campus for 3 weeks, and she's been to the ER 4 times with severe vomiting because of ongoing gluten exposures in the dining hall. She has met with dining services, disability services, and the campus dietitian for support, but she continues to get sick. What does she do next?
I think we
Let's
should
see.
first find out, is this all celiac disease or not? Because obviously there are other reasons for these symptoms as well. And I think going back, I mean, this poor young lady has been too many times in the ER, so perhaps reaching back to her primary clinical team and having a conversation with them as well. This is where you should lean back on whoever your clinical team is. They should be helping a little bit with that as well. That's what I would suggest to Liliana.
Yeah, I definitely agree with that. That is really unfortunate to be having to go to the ER in those first few weeks of college. That's such a huge adjustment to also have that involved. Something definitely needs to change. So I would say that the disability office needs to be in contact with the dining hall. about their protocols, because if this is solely celiac related, something is clearly not right and needs to change as far as their cross-contamination protocols. Something that they could do for her is the option to pre-order meals for the week, or even some schools do offer the option to order like prepackaged or like frozen meals from like a third party vendor off campus that is dedicated gluten-free. I do know some schools offer that, not all. Especially in this case, since she goes to a smaller school in New York, she might be a little more limited on the capabilities that they could have, and they may or may not have options in the area for off-campus dining that is gluten-free and safe. But I would say definitely advocate for herself in this situation with the disability office and work with dining services to help come with a solution. If not, then she needs to go to housing with a full kitchen.
Great, thank you. So Elliot is sick at school and he needs help. He's a sophomore in college and he's been successfully eating gluten-free for the past year. But at the start of this new year, there was a new food service provider and he has been glutened at least 3 times. He is currently recovering from a virus and was glutened by supposedly gluten-free chicken noodle soup provided by the dining hall. He's been vomiting for 3 hours and feels miserable. He doesn't know who to call for help. Dr. Verma, does he call you? Who does he call?
I think he should have done his homework and found out from the college campus, from the the health services, where's the closest, where can he get his IV fluids, and then he calls me. I'll help him. But I think I think this is where it's so unfortunate that these things do happen, and we just need to be prepared ahead of time. So know who else to call besides calling your parents. I think it's always mom or dad first, but I think knowing where you have to go to get that help immediately. So knowing where's the urgent care, where's the going to the nurse would be the first person to know the nursing hours, how many hours are there in the college campus thing as well, because I don't know if the nurses are there 24 hours, they're only there 12 hours. So one would need to know that, but he does need some fluids.
Dr. Verma, how could Elliot determine if he was actually glutened or if it's the virus that's making him vomit?
So I think the first thing is to take care of the vomiting, that we want to bring him, stabilize him, and so on, and then go back to, what did he eat, and be able to look at that and see, was there some gluten or not? And, sometimes there are other people who are ill as well, so that makes it a little bit easier from a viral illness, but sometimes not. And it's hard. It's very difficult to figure out whether it's virus or otherwise. But I would say, yes, think about it being gluten, but also think about there could be something else. So always go back and see, what did I eat? How could it have been? Is there a chance or not? To go through both the aspects.
Great, thank you. And our last case for today, meet Julia. Her school refuses to accommodate. She's a freshman at a large state university in the Midwest, and she was diagnosed with celiac 12 years ago. When she attended Admitted Students Weekend and asked about gluten-free options, she was told not to worry, that she just needed to speak with the dining hall manager when she arrived at school in the fall. Now on campus, she finds very few gluten-free options and a manager almost impossible to find when she comes to eat. She met with the University Disability Office and they said they can't help her because her academic record is not affected by her celiac disease. What should Julia do?
Well, to start, they can't tell you that. Since it's a school that receives public funding, and as Vanessa mentioned earlier, celiac disease is acknowledged under the Americans with Disabilities Act. They legally do have to accommodate you. Maybe a good place to start, I would say, is you could get your doctor or your care team involved if you need to, so they can provide documentation and have that diagnosis letter to really show your school staff how serious your disease is. And if it's not taken seriously and accommodations are not made, that it will absolutely affect your academics. So I think that would probably be where I would start.
Absolutely. This is definitely a situation where your doctor can be a super big help to you in writing a letter explaining all of these things to the school. They're required by law to look at that doctor's letter and to accommodate as your doctor has prescribed. And so this is a situation where your doctor can be super helpful, especially when the disability services offices isn't quite getting it.
Totally
Right.
agree with that. And I think that nobody should feel shy of reaching out to their primary team. This is where everyone is here to help.
Well, thank you all for helping us talk through these cases. Oh, I forgot, we added another one. I forgot about Justin. This is the best one. Okay, Justin's friends say join in the fun. Justin is a freshman at a large school and was diagnosed with celiac when he was 3 years old and not growing. He does not have a noticeable reaction to gluten ingestion, so we call him asymptomatic. Greek life is a big deal at his school, so he is pledging a fraternity, and at the parties, the brothers regularly suggest having a gluten-containing beer and participating in Flip Cup, especially since he isn't symptomatic. Up to this point, he hasn't consumed gluten, but is considering it to fit in. Doesn't matter if he has a beer occasionally if he doesn't feel sick.
The short answer is yes, it does matter. And yeah, there's no safe amount of gluten for him. But taking my doctor hat off and being and remembering back to when I was a college student, I mean that is the reality, is that you have all these pressures around you, and how do you handle these? The great thing is that there are alternatives. So I mean, again, it goes back to communication, right? Like nobody should be judging you for grabbing a hard seltzer instead of a beer. Of course, age, assuming that you're at the age to do so. But yeah, as long as people understand, as long as people know, it's very unlikely they're going to hold it against you nowadays.
Yeah, echoing that, I would just say, if you haven't already encountered a scenario already where someone asks you, well, can't you just have a little bit, or like just have it every once in a while? It's very likely that you'll experience that once you get to college. So do not be afraid to speak up for yourself, and you can absolutely participate in all of the fun things that college has to offer while still being gluten-free.
Awesome, thank you. All right, so now this has been a little stressful thinking about all of these things. And so I want to ask Jonna to come on up and talk to us about how we manage all of this stress in the college setting.
Great, thanks so much, Vanessa, and nice job everyone with the tricky situations and problem solving there. Those were some great ideas. So we're going to talk about managing anxiety and stress. And first, before we do that, we're going to think through how stress and anxiety impact our body. And just, I think, for some context, right? I think you've heard from Dr. Verma and Vanessa and Dr. Ford that really the importance of contacting your primary team, your GI team, right? And usually within that team, if you haven't met one already, there's a social worker, a psychologist, some kind of support person. So I'm just kind of reminding you that I'm giving an overview and hitting some highlights here around, these pieces. But for further conversation around this, I think it's great when you talk to your team about your transition to college to really ask if you have a support provider there, a social worker, a psychologist, that you can problem solve about individual questions around anxiety. So next slide. Okay, great. So stress and anxiety. So one thing I just wanted to kick it off with is, Vanessa was talking about all these changes that come up with campus life. And this is a huge transition in and of itself, no matter with or without celiac. But I think this other layer of having a celiac diagnosis, even though you may have been managing it for some time, or for some of you, it's a newer diagnosis, right? This kind of intersection of transition to college at this developmental stage, and kind of navigating a chronic illness away from home, turning 18, managing some of your medical care and situations kind of away from home. All of that can bring up some normal stress and anxiety. And I just want to kind of normalize that's okay. And we're going to talk through a couple pieces here, couple strategies, and kind of food for thought. So plant some seeds around around thinking through your transition. So just stress, of course, we're thinking, comes with a transitional period, a new diagnosis, something pops up, and anxiety, you can see the difference or the descriptions here. I'm not going to read through them, but, we think about if anxiety persists longer, right, or impacts functioning in some way, then I think we're going to talk through some other ways to seek support around that. But I think we're kind of covering the bases of, this general transition with a celiac diagnosis. So we'll go to the next slide. So you've heard so much about a lot of these external and environmental kind of strategies for navigating college. So what resources you can utilize with your home team, right, your medical care team, and then also at school, disability services and academic support, kind of the health center, right, all these pieces. And then even just navigating, right, talking to a roommate, talking to kind of your new living situation. So all of these are kind of in our environment. But I think of kind of our nervous system when we talk about regulating it, we're talking about some of the internal strategies. And as you can see here, we're going to kind of go through, talk about some mindfulness, exercise, sleep hygiene, all those pieces that can set us up for success, no matter kind of what is going on additionally medically, but particularly I think when navigating kind of this transition and trying to kind of prepare and set ourselves up for success with this other layer of nutrition, right, and gluten-free diet. So these two pieces and how they come together is what we're kind of gonna think through. So we can go to the next slide here. So you can see my friend here. I've had some names come up for him through my time using this slide, but he is clearly experiencing some distress, and some of that distress looks physical, right? So sometimes when we think about stress and anxiety, we think about the worries and kind of what's going on in our brain, but really stress and anxiety can also present very physically. And so you can kind of look at the symptoms and just, take a little individual inventory. And I'm sure many of us have experienced one or more of these at some time, right? Whether it's being nervous about a test or a new social situation or a transition. So we know all of these are kind of, coming up in that transition to college. And really, I like to use this visual as well, because there's this overlay and you can see this nausea and lack of appetite, but they don't even mention some other GI symptoms that, we know can be associated with an exposure or, having kind of GI symptoms, at point of diagnosis, et cetera. So I think just understanding that this mind-body connection exists and stress can play out very physically, and then kind of identifying, right, that there's physical symptoms that, do go along with cross-contamination or, an exposure, right? And there may be some overlay there. So we can go to the next slide from here. So in understanding this nervous system response, the nervous system has two parts. So we talk about parasympathetic and sympathetic. And so you guys may have studied this at school. So parasympathetic is this rest and digest. And obviously we're in the GI department, so we're thinking about this this digestion, and obviously our conversation relates. And then sympathetic, we're talking about that fight, flight, or freeze, that activated response, right? And our nervous system is going in and out of these. And so that's totally normal. But I think what we want to make sure, we're educating and starting the conversation about here with you is really how, when our nervous system is activated and we're stressed and we're noticing this impacting our body, impacting kind of our, our functioning and how we relate to people. I think being able to have tools that help us shift and regulate our nervous system to the parasympathetic, right? So that rest and digest, that state when you're sleeping. Of course, we're not going to be sleeping all the time, but really having some tools. And you can see here that both, right, the different systems in our body are affected, and the GI tract is so closely connected to the nervous system that's really kind of an important thing to recognize. So we're going to go to the next slide. So here I'll credit one of the psychologists in our division created this slide, but right, this ongoing conversation between our brain and our gut. And I think with a lot of what we talked about today, kind of some of the stuff that could come up around a celiac diagnosis in college, really just thinking about, some of these situations and scenarios that we've talked through with those tricky situations. social scenarios, roommate situations, an exposure at school, feeling worried about being sick away from home or not having access to the right food, all normal things to be worried about. And especially if you've had an experience where something has happened where, your GI system didn't respond well, right? Then it's kind of that back and forth between brain and GI tract of like, is this going to happen? And so really part of the idea of having some strategies is to help your brain to reset and also to help your body and nervous system regulate, right? So we know, we have to prepare as much as we can, but there are things that are out of our control. So really focusing on what you can control, which is what we're going to talk about next. So I will ask to go to the next slide. So here we can see our cartoon friend is doing some diaphragmatic breathing or belly breathing, and you can see kind of some of the benefits here, but really the idea of helping to regulate the nervous system and helping to reset. And I think the idea of this, and I like to introduce it as, we don't have to go meditate on a mountaintop for days at a time, but really how do we bring practical strategies into everyday life that you can kind of pause and reset and know when you're starting to ramp up and get worried about things and you feel like it's affecting your brain and your body, how do you have a few tools in your toolbox to reset? And some of you may have those and they are working well in, your current high school or, if you're already in college, but really having a couple more. So if you're not able to access like your go-to one, if it's running or if it's talking to a friend, to have a few more. So we're going to move to the next slide. Yeah, so if we're going to give this mindful breathing a try. So just 2 to 3 minutes really of, and I'm going to guide you through kind of just a breathing activity. So if you're interested in joining, awesome, would love that. And if you're just kind of chilling and you want to like observe and not participate, that's okay too. So I'm going to walk you through it. So if you are seated in a chair, couch, floor, I want you to just find the most comfortable seat for yourself. And then, once you kind of are in that seat, just starting to notice the contact of your body with what's beneath you. So if your feet are touching the floor, noticing the contact of your feet with the floor, noticing the contact of your seat with the seat under you, your back with maybe the back of a chair or couch. Rolling your shoulders back and, just kind of settling in physically. And then I'm going to ask if you can lower your gaze or close your eyes, whichever is more comfortable for you. And often I find it helpful with breathing to put one hand on my upper chest and one hand on my abdomen just to notice the difference, right? Because shallow breathing is going just to our chest, but diaphragmatic breathing is really having our abdomen expand. So as you lower the gaze or close the eyes, turning your awareness and attention to your breath. And all we're doing here is really following our breath. So following the inhale all the way in as our abdomen expands, and then our exhale out as we empty air from our lungs. Without feeling you have to do or change anything, you're just staying with your breath. So bringing your awareness to your breath and your attention. So even if there's thoughts going on in your brain about what we just talked about on, the prior slides or what's next or when does this end, really seeing if you can use your breath as the anchor to bring you back to the present moment. And there's really no wrong way to do this, right? It's just a practice. So inhaling, follow your inhale to feel expansion. And as you exhale, you might, feel your abdomen deflate under that hand. And just coming back to the breath and paying attention. And seeing, if you, as you pay attention to your breath, if it helps to slow things down, right? And some people like to do counting to see if they can get kind of their inhale and exhale even. So if that's helpful to you to, give a count to 2 or 3 or even 4 for the inhale and expansion, and on the exhale counting until you come back through. So we'll take just a few more breaths. We think about parasympathetic nervous system as 5 or 6 breaths within a minute time. So if you can really try to slow that breathing down. And it's okay if your mind is going to different places, but just seeing if you can, again, bring awareness back to your breath and use it as your anchor. Just paying attention on purpose, and whatever shows up is okay. So as we take these next couple breaths together, I just want you to kind of take a little inventory and see. So in Boston today, it's a rainy day. So that's kind of our weather report outside, but just check in for the weather report to see what's going on inside. See if anything since you just sat down and started this activity is shifted or changed, just with a minute or two of breathing. Notice if anything shifted for you or anything settled down. Then another inhale and exhale, just staying with your breath. And just knowing you can come back to this, but for now, we're going to start to bring our awareness back to our body, back to the contact of our back and seat and feet with whatever is beneath us, and then gently opening the eyes and kind of rejoining our shared Zoom space here. And just, take a little inventory for yourself if that shifted anything for you. And so just like another tool for your toolbox, to try. And particularly, like, I find when I'm working with kids, if they're active but they're not feeling well, this is a really good thing to be able to have as kind of another a backup managing anxiety tool. So we'll go to the next slide, which should be these are some great apps, and you may already have these from your teams or from your school, but some awesome apps that kind of just teach and give an introduction to meditation. I like Headspace, the Calm app people have probably heard of, but these are things that you can use, and some of them are kind of helpful with sleep as well. But you could take a photo of this, or I think you may get a resource of this after, but definitely feel free to take a photo of this list. But just to kind of start and see if this is a helpful thing for you. But I wanted to explain the nervous system because it's like there's science behind this. When someone tells you to take a deep breath to calm down, there's that parasympathetic sympathetic nervous system balance, right? We're really actually helping to train ourselves to shift into the parasympathetic, and that can only help us as a whole person, but also help kind of manage feelings of anxiety around a celiac diagnosis and around a big transition. So from here, we'll go to the next slide. Okay, so shifting gears a little bit, this is kind of like the background of, we talked about the body, how anxiety affects that, but just, how our thinking can get revved up. And so everyone gets caught in what we call thinking traps in cognitive behavioral therapy. But, fortune telling, catastrophizing, overgeneralization, all or nothing thinking, kind of the gist is either thinking about what could happen in the future that could be a negative thing that can impact us, or what has happened and kind of worrying about that. So really, we can all go down this, I say, rabbit hole around the what ifs. And I think, we saw through some of those tricky situations, that the challenges can come up, right? And that's life. And so the thing that we're trying to do is really help empower you guys to have some tools and to recognize, like, okay, maybe my brain is taking me down that, but what is in my control that I can work on? And we talked about those internal things to focus on, and also external, right? So setting up, your plan with disability services, but also having some coping skills. So we want to make sure we can kind of have good positive self-talk, so we can kind of get ourselves out of this cycle. So the next slide, please. Okay, so we have this idea of all or nothing thinking, which we talked about, versus cognitive flexibility. So that's kind of what I was referring to a little bit with positive self-talk. So this is just like the tip of the iceberg with this stuff, but you can see kind of the examples. And I think sometimes if our brain starts to go negative, we can just recognize that a thought or having anxiety about something does not mean it's going to happen, right? And so starting to retrain ourselves to come back. And then just another example in terms of college life, right? We can be nervous about having a new roommate or going to a social event and, being able to access the right food or checking out the dining hall for the first time. But I think just knowing that, the and here versus the but is super important, because it's okay to be anxious about these situations. That's really normal, but it doesn't mean that it's going to hold us back. And I think all the providers here have really emphasized that, you're not defined by this diagnosis, right? But just kind of finding out how can you kind of reframe in your brain, right? And have positive self-talk and know you've done the things to the best of your ability to help set yourself up for success. So we'll go to the next slide. Okay, so what can we focus on? So we've talked about a couple things. So we'll keep going to the next slide to hit a few more. So one thing I always think, is so important, right? If someone comes to me and says, I'm so anxious, and I'm getting like 2 hours of sleep and I'm on my phone for, 3 hours at night before I go to bed. So thinking about what our sleep hygiene is. So just like you brush your teeth, or, you take a shower, all these things that are self-care, sleep practices are also self-care. And so with a little bit less structure and more autonomy and independence in college, super important to think about your routine and how it impacts you. And I think this can really help overall in terms of anxiety. And also caffeine is such a trigger for anxiety too. So kind of like taking a little inventory for yourself. What do you do now for these habits at home? And then kind of noting like what works for you as you carry them over into college. You can kind of check out some of those, but we know some screen time and getting exercise during the day, kind of all these pieces really play into, your anxiety in the following day and subsequently. So we'll go to the next slide. Okay. So, I think you're managing this diagnosis of celiac and all your kind of activities at present, and you know what works for you. And for some of you, I think you're probably, involved in whether it's music, theater, sports, have a routine. And then when you get to school, what I've seen be so helpful to kids, and, maybe either, Dr. Ford or Emma can add to this too, is just like finding what works and really, having time to make that a priority, especially around like exercise and activity, to kind of manage a baseline of anxiety through this big transition. Really doing what works. Exercise, right, helps us with all these good chemicals in our brain and endorphins that help kind of regulate the mood and overall anxiety. So, in terms of like the other piece of celiac and navigating that, I think just managing your baseline with sleep, good routines, and support is super important. So we'll go to the next slide. Okay, so lastly, just like these external supports and services that could be super helpful. And I think great to rely on these, especially if you're navigating kind of setting up all these routines and, talking through some of what's going on or troubleshooting any of this that comes up. Universities have counseling centers, individual counseling, group specific support. Some of them are geared specifically towards managing anxiety, and it can be just general, around the transition. There's often peer-to-peer resources. We've talked a lot about disability services and academic supports, but leaning on those supports and services and really identifying them before you go, so that when you go, it's always harder to reach out when you're kind of in a point where you may need support. So I think knowing, what your external supports are before you go is huge. So I think that's my last slide. And yes, I really appreciate all your attendance and input here. So I wish you luck in your transition to school.
Thank you so much, Jonna. Alrighty, so I'm going to hand it over to Megan now.
Yeah, hi. So I am here really just to talk about some of the resources that Schar can provide. I'm a registered dietitian and I feel very passionately about this subject, and I'm trying to help people as they navigate these experiences. And I know some people, just need some assistance having the conversation. So we've done a lot of really cool things. I have some examples on this slide, but we've provided samples and swag bags for on-campus events. We've had a lot of students reach out to us and say that they're trying to educate people on their campus about celiac disease, or they're trying to get better gluten-free options in their dining services. And so they want samples sent, and we can absolutely provide that. So this is an example of a student who was doing an education outside of the library during finals week, which I thought was really cool. And they had little bags. You know, we can help facilitate conversations with dining services if they have limited options. I've done trainings and in-service meetings with campus dining services. So if your school doesn't really know where to go to find training, or they don't have maybe funding or resources to find training on how to handle gluten-free students, we do that. We actually work with a company that does a really nice training, and we will support you through that. If there's a food pantry on campus, we will absolutely donate to that. So check out those resources, and you can always put them in contact with us. You can just reach out to through our consumer services forum, and it'll direct you to me and I'll help you get those resources for your pantry. And then I will also send dorm kits for gluten-free activities. So similar to the swag bags, if you're doing something in your dorm and you need something, we can always do that. I can't send shipments to everyone for free. I wish I could, but I've seen some good ideas in the chat for maybe having some college bundles. And so I'm going to bring that to the marketing team. But we have a lot of resources too. We have these wonderful handouts that our dietitians have made. So a dorm recipe book and an advocacy guide that basically just summarizes a lot of the information you learned tonight. So you can go to the next slide, Vanessa. All right, and then I just wanted to point out that Find Me Gluten Free has a really good resource for colleges, and it's growing. So, you know, this is an opportunity to kind of help others as you're trying to learn more information about where you're going to college. So definitely, if your school has a good setup for gluten-free, I would say, you know, write a review, try to build this resource so that it can help other people. And then it can also, of course, be helpful for helping you find options in the cities that you're in. But I just want to point that out because it's a newer database, and they're really trying to grow it so it can have a lot of good and helpful information.
All right, Megan, do you want to announce the big scholarship?
Yes, so we love doing this program because we want to help people be able to navigate a gluten-free diet. And I think this is one of the more exciting parts about my job, is that I get to support programs like this. And so we are offering a scholarship for one student, and really the goal is to help you with the gluten-free diet and, you know, make things easier for you while you're transitioning to college, or if you're already in college. So use this QR code to apply for the scholarship. The deadline is May 3rd, and we'll let you know in June of 2024. So this year, you do need to be a college senior or already a college student to apply for the
High
scholarship.
school senior, right? High school
Yes,
senior.
high school senior or a college student already. And we do this program, we've done it for what, 3 or 4 years now, Vanessa. So if you're not in that age bracket, keep coming because we hope to keep doing this.
Yes, so there's a QR code on the screen now, and there will be an email that will go out tomorrow to everybody who attended tonight. Please remember that you, as the student, need to apply for this the scholarship yourself. Mom and dad cannot be the ones filling out the applications. We were talking earlier about last year. It's really obvious when mom and dad fills out the applications because it switches between the student talking and the parent talking, and it's pretty obvious. So make sure that you guys fill out the applications yourselves. And we are really excited to have this available again. So thank you so much, Schar, for being a part of this and for supporting the Society for the Study of Celiac Disease. Thank you to all of our panelists for being here tonight. We're so grateful for all of your insight and wisdom and personal experiences that you've shared. And thank you to all of you, the students who joined tonight, and families. You know, education is really where all of these accommodations start, and making sure you know what the right things are to ask for. So thank you for coming and for learning and for being a part of this tonight. And be on the lookout tomorrow for that link, or go ahead and use the QR code tonight. So thank you everyone for coming tonight, and have a good rest of your night. Goodbye, everyone.